Hello, this is Dr. R.K. Singh, and today we will discuss a very common and frustrating problem known as dry mouth or xerostomia. Dry mouth is caused by a reduced or absent flow of saliva. This condition causes discomfort, interfering with speech, swallowing, making wearing dentures difficult, also cause bad breath, halitosis, and worsen oral hygiene by causing a decreased acidity of the mouth as well as increased bacterial growth, which contributes to the development of cavities in the teeth. Long-standing dry mouth can result in severe tooth decay, candidiasis of the mouth. Dry mouth is a very common complaint among older people. The various causes of dry mouth include the salivary gland or the gland which produces the saliva. They malfunctions and they cause the decreased salivary production. There are many causes including dehydration and mouth breathing. The most common cause of dry mouth are usually drugs, radiation, or in case of head neck cancer during the radiotherapy. Drugs are the most important cause overall. Approximately 400 prescribed drugs and many non-prescribed drugs over the counter medicine cause a decrease in salivary production. The most common class of drugs that cause xerostomia or dry mouth, including those drugs with anticholinergic effects like drugs that block acetylcholine, like antiparkinsonism drug used to treat the Parkinson disease, the cancer chemotherapeutic drug. Most commonly use of drugs like anticholinergic effect, the dry mouth is usually among the most common anticholinergic side effect of these drugs. Many chemotherapy drugs cause severe dryness and mouth sores, which is called stomatitis, where they are taken. These problems also end when the drugs are stopped. Other common drugs that cause dry mouth include antihypertensive drug, that is drug used to treat hypertension or lower down the blood pressure, or anti-anxiety drug used to treat various kind of anxiety disorders, antidepressant drugs used to treat the depression. Now, there is a concept of illegal amphetamines use result in a kind of a meth mouth, which is also causing severe tooth decay caused by methamphetamine induced mouth changes. The damage is worsened by tooth grinding, clenching caused by the drug, the head of the inhaled vapor, and probably the elevated intake of sugary beverages and the poor oral hygiene while using the drug. This combination cause a very rapid destruction in teeth and a lifetime of dental problems for the younger population as well. Tobacco use usually cause decreased saliva. Radiation therapy for head neck cancer can cause severe damage to the salivary gland, often causing kind of a permanent dryness or xerostomia. Even low dose radiation can cause temporary dryness leading to damage to salivary gland. Less common cause of dry mouth include body widening, systemic disorder. Dry mouth is usually common in patients with Sjogren syndrome. Some people with diabetes or HIV infection have commonly a dry mouth problem. Now, to evaluate the dry mouth, we have to see that not only people with dry mouth needs to be immediately evaluated by a doctor. The following information will help people to decide whether a doctor evaluation is needed and help them to know what to expect from the evaluation in a hospital by a doctor. The warning sign in people with dry mouth, that is certain symptoms and characteristic causing the concern for dry mouth, which include extensive tooth decay, dry eyes, dry skin rash and joint pain. Now the question arises when to see a doctor. People who have warning sign should see a doctor right away. People with extensive tooth decay should have a kind of a dental examination. People with a dry mouth but no warning sign, or otherwise they may feel well, may also see a doctor so that to evaluate any cause of a dry mouth or xerostomia. The doctor will actually examine you and ask you, following questions pertinent symptoms and medical history. The symptoms of dry mouth, irritated skin, eyes, rash or joint pain may possibility of a Sjogren syndrome. Doctor will ask about the history of past and current kind of a radiation therapy of head neck cancer and a diagnosis of risk factor for HIV infection as well. Doctor need to know all about the drugs what person is taking to find out whether any drug is leading to this condition of a dry mouth, which has to be stopped on an urgent basis. Now doctor does a physical examination of the patient, which is actually focused on the mouth and the dentition to see the degree of dryness. If the degree of dryness is really unclear, doctor can hold a tongue, depress against inside the cheek for about say 10 seconds. If the tongue depressor falls off immediately when released, the flow of saliva is considered to be normal. If there is difficulty in removing the tongue depressor, the flow of saliva is really not normal. And in women, the lipstick sign, that means where the lipstick sticks at the front of the teeth, may be a useful indicator for elucidating the dry mouth condition. Doctor also examine the mouth for presence of any sores caused by fungus, which is called as candida albicans or the oral thrush, and check condition of the teeth, for instance whether there are any cavities in unusual places. Unexpectedly severe and rapid tooth decay may be a sign of a illicit drug use, particularly methamphetamine discussed earlier. What doctor finds during the surgery and the physical examination often suggests a cause of dry mouth, and the tests that may need to be done also are elucidated. If dry mouth begins shortly after a new drug was started, doctor often tries stopping the drug to see whether symptoms go away or not. Testing, sometimes doctor tests how well the salivary glands are functioning